Well, moving on now, the Centers for Disease Control are urging baby boomers to get tested for hepatitis C.
According to the CDC, those who were born between 1945 and 1965 are 5 times more likely to have Hep C than other adults. WENY's Asha McKenzie spoke to local health officials to find out more. She joins us live in the studio. Good evening, Asha.
Good evening, Renata and Ben. The CDC reported that 75% of adults infected with Hep C were born in the 20-year span of 1945 to 1965. Now, most boomers became infected with the disease in the 1970s and 80s when the rate of Hep C was at its highest. Hep C is spread when the blood of an infected person enters the body of someone who is not infected. Some symptoms of Hep C are fatigue, nausea, loss of appetite, abdominal pain, and yellowing of the skin. But those who are infected with Hep C can live for decades without any symptoms, but will have severe liver damage. The CDC says many baby boomers are unknowingly living with the virus they may have contracted many years ago. Prior to 1992, blood was not tested before an organ transplant or blood transfusion.
Sometimes people don't show symptoms for up to 30 years after contracting the disease. A lot of times by then there's liver involvement, cirrhosis, and that kind of thing. So I would suggest talking to your provider and seeing what your risk factors are.
Now, health officials say it is important to get tested for Hep C because there could be no indicator. If diagnosed, your doctor can provide further information on treatment. Asha McKenzie, WENY News.